Good afternoon, everyone. Richard Anderson Martinez, Director at UNE for Intercultural Student Engagement, one of the co-sponsors for today's event. Thank you all for being here. As you know, part of the IPE initiative is to increase your experience with diverse communities and populations in Maine and New England, so thank you all for being here. I'm going to turn the microphone over so we can get started today. We have staff here from Preble Street's Anti-Trafficking Coalition. Thank you. Please give them a round of applause.
Thank you very much, Richard. Hi, everyone. My name is Ridelphine Katabesha. I am a case manager at the Preble Street Anti-Trafficking Coalition, and my job is to provide services to victims of human trafficking, and I also do outreach, training, and that's why we're here today. I'm going to let my colleague introduce herself.
Hi, everyone. My name is Caitlin Corrigan, and I'm the supervisor of the Preble Street Anti-Trafficking Coalition. I also do direct service work with the clients that we serve, and I also do all of the screening for people with the folks that we serve, and those are survivors of human trafficking who are residing in Cumberland and York County.
Okay, thank you very much. So a little bit of more housekeeping. You have some handouts. I think everyone got. If not, sorry, we just got those. So in the back of them, there is some paper evaluations. So we would like you, after this training, to have some time to just fill out those papers. That's way we know how our trainings are going on and if we need to improve in the future. Again, thank you very much for having us. So first today, as you all know, we're gonna talk about human trafficking, identification, and response. So the objectives of this training is to help you understand the definition of human trafficking. We're going to have an hour and a half. Hopefully you're going to understand because it's a really complex topic. And the other objective is to learn how to identify victims or survivors of human trafficking. And in this training, we'll be using that language, like victims or survivors. They are victims or survivors of human trafficking, depending on where they are at, depending on whether they are still experiencing human trafficking currently, or they identify themselves as, have survived that situation. But so in each of your fields, you can use anything, like you can use whatever you will use for like patients, for healthcare providers. We call them clients as case managers. You just want to make sure you call them the way they would like to be called. But in this training, victims and survivors. All right, so and the last objective of this training is to help you know how to meet human trafficking victims or survivors' needs, and or to refer them to services that are available for them.
So we're going to get started with our PowerPoint. We have a pretty brief presentation that's packed with a lot of information, so we're going to be moving pretty quickly because we want to save time for the last half of our time together today. We're going to be joined by Professor Alicia Peters, who's a UNE professor and something of an expert on human trafficking, and we're really lucky to have her as part of our community. So we're going to be doing a Q&A panel at the end. So if you have questions throughout the presentation, please feel free to jot them down and hang on to them. We're going to leave ample time for questions, but for the next about 35 to 40 minutes, Ridelphine and I are really going to cruise through a lot of information about the definition, the indicators, as well as the service response to trafficking.
So now we're going to start with a video, a really short video, and we're going to let you watch that video. And we want to make this training as much interactive as possible. So after watching the video, we're going to need your reaction to that. Thanks.
Okay, so I know that might have been a little bit difficult for some folks to see, but I'm hoping most people were able to generally get the idea. So what we'd like to do now is let's just take 2 minutes, and if you can just sort of turn to the people that are right around with you and just sort of talk about your reaction. What did you see? What was happening? And then we're going to come back together and share out a little bit about that and how that video might have gone along with what you might have already heard about human trafficking, or perhaps this is the first time you've really heard about it. So just take about 2 minutes to discuss your reaction, and then we'll come back together. Okay, so let's come back together. And I'm wondering if I have someone who wouldn't, normally when we do these trainings, we just sort of have people call out and have a conversation, but in a room this large, we'll do hand raising. If someone can just raise their hand, I want to hear just a sort of a quick summary of what you took away from that little video, just to get us started, so we're all talking about the same thing. So what did you see? Yeah, thank you.
I just said that it's just a cycle, and they only get enough to like survive in the moment, nothing to save up for them to get out of that cycle.
Yeah, and so something else I heard before the microphone was there was that people aren't able to get beyond just the basic needs, so sort of trapped in this cycle of just basically meeting their needs. Yeah, over here. Thank you for being Ellen and Oprah.
We kind of talked about how I feel like a lot of people's initial thought when talking about human trafficking is like women and sex trafficking. And I thought this video was a really good way to show that that's not just what it is, it's a whole variety of different aspects.
Cool. Yeah, what we're going to be talking about today is really giving you a definition of human trafficking as it's defined by the federal law here in this country and what that looks like. And there's a range of different ways that can look. And so here in Maine, we are actually seeing more cases reported of commercial sex trafficking, and that's definitely something we're going to talk about today. But it's also a larger problem that occurs really in a range of settings. So that's absolutely something we want to focus on. Yeah, thank you for highlighting that. Maybe another couple reactions, and then we'll move on.
I'll make sure I be as fast as possible.
So I saw, with the exception of the passport, a lot of minimum wage jobs in the U.S. seem to be that.
Yeah, interesting. A lot of minimum wage jobs in the U.S. seem to be similar, right? And this is, a little bit beyond the scope of what we have time to get to today, but I think that's a really good point, because when we talk about, maybe why do we focus or why are we seeing more sex trafficking victims than labor trafficking victims, that's a really great point, that part of the way that our, current economic system is that we kind of accept that people might be in really bad working conditions, and that might just be part of how things go. But another thing I want to highlight, the existence of the passport. What did people see with the passport? How was that used in that video? Yes. Yeah, so they were holding it and keeping it from that person. So that's definitely a tool that we see traffickers use, and that's part of what we'll talk about today. Great, thank you guys. So before we move into some of the definition, we're just going to give you kind of a little bit of a big picture of trafficking. So just a couple literal bullet points to keep in mind. So trafficking doesn't happen in isolation. Often when someone is trafficked, this is the result of a number of failed systems. And so this could be someone, who had been raised as a child in the foster care system and experienced abuse, or someone who was trying to meet their needs through, employment, or meet their mental health needs by trying to access providers and not having insurance. So this is something that really affects people who are marginalized and oppressed already, and that's really what makes them vulnerable. It's also not a new crime. We're going to talk about the law and when it was started, but people taking advantage of other people's labor, this is something that the foundation of this very country was built on. So this is not an old crime, but the way we talk about it is new, and it's really being addressed formally for the first time in a while. So if you feel like you're just starting to hear about it, you're not alone. We're all sort of getting collectively smarter about this issue. And then the final point, just to kind of put out there as a big picture context, is that this is a very difficult crime to prosecute. And part of the reason is that people who are victimized in this way have a lot to fear. They might fear going to jail. They might fear being deported. And we're going to talk about some of those reasons. So when we talk about this issue, yes, it's a crime, but we can't only talk about it in terms of prosecutions. It's actually much bigger than that, and really arguably an issue, a public health concern.
And as Kathleen just mentioned, we're going to talk about a little bit about the definition of human trafficking. And first, we're going to talk about the law, which is the Trafficking Victim Protection Act, which is a federal law. It is really recent. It's just an 18-years-old law. And again, as Kathleen mentioned, it doesn't mean that human trafficking hadn't been happening before, but it's just recent that people are, paying attention on that crime. And that law established the crime of human trafficking, and also work on prosecution and protection. So in terms of definition, human trafficking as defined by the Trafficking Protection Act is compelling into labor, commercial sex work through force, fraud, coercion for an economic gain of the trafficker. That's the first component of that law. And the second component is that any minor in commercial sex work is considered as victim of human trafficking. So the point here is that for a minor, it doesn't have to be a trafficker, so we can talk about human trafficking. So even if there is a non-trafficker, as long as it's a minor who is engaged in sex work, that's trafficking. And then another thing that I would like to mention about the TVPA is that our program, Preble Street Anti-Trafficking Coalition, is a program that comes from that federal law. So we are funded by the Department of Justice, and we go from this legal definition to screen our clients. We are going to look for force, fraud, coercion to determine whether or not they have been, they are recognized as victims of human trafficking, and they can have our services. Yeah, sometimes they don't respond to that law, but we just can't give them services, but we help them connect to other services that are available to their cases. And so from this definition, we're going to just try to break it down a little bit. So trafficking is like recruiting, any person who is involved in recruiting or harboring or providing or obtaining for a person, again, using those means, which are force, fraud, coercion, for for a purpose of economic gain of a trafficker, and we see their exploitation, servitude, their bondage. Those are all cases that we have been seeing while working with human trafficking survivors or victims. And now, who are traffickers? You know, sometimes we can think that traffickers are particular people that we can identify easily, but actually traffickers can be anybody, can be like our neighbors, we can be living with traffickers around, they can be, our romantic partners, members of our families, they can be, it can be an organized crime, or it can just be an isolated fact situation. They can also be employers. For example, the short video that we just saw. So traffickers are everywhere. I'm not trying to scare you guys that you can meet traffickers everywhere, but these are the realities that we live with working on human trafficking. And where we can find human trafficking, in all these places we can find human trafficking. And as Kathleen mentioned, we talk about sex trafficking, and we see a lot of cases of sex trafficking, especially in Maine, since prostitution is a crime. Sometimes we have our clients referred by law enforcement, and there are people who have been first arrested for prostitution, but when they find out that they have been forced to do that work, then they are recognized as victims of human trafficking, and they get referred to us. So, but also we want to really, because there is a higher awareness about human trafficking, we want to really also talk about labor trafficking, which is also a reality. So all these places, childcare, manufacturing, everywhere, all these places you can find human trafficking that is happening.
So now we're going to talk a little bit about how traffickers actually operate and how they're able to both recruit victims into a trafficking situation and also continue to control them. So I'm just going to expand a little bit on the language that Ridelphine laid out from the TVPA and really talk about those three elements, the means by which someone is trafficked, and those are force, fraud, and coercion. So when we first off talk about recruitment, this is something, the first bullet point there is something we see very frequently, so bait and switch. And basically, that sounds just like you think it would sound. So someone agrees to a situation that, seems like a reasonable work situation. We have a client right now who we're working with. She was recruited in her home country to work with a family, provide childcare, cook meals, and she signed a contract and agreed to the terms of her employment. Sounded like fair pay, reasonable time off, all really good things. And what happened when she got to the States was that contract was, pretty much torn up and laughed at and completely ignored. So this idea of like false contracts, that can absolutely be part of it, and traffickers are recruiting someone who want a good opportunity, who want a good job. We can also see this with people who may already be engaging in some forms of, illegal activity, who might be willingly engaging in prostitution, trying to make money, and connect with someone who says that they're going to assist them, whether that's with providing them with some protection or, transportation to the dates that they're arranging with people who are buying sex. And what actually ends up happening is that person, exerts these elements of force, fraud, and coercion, takes their money, hurts them, forces them to do what they're doing. And so again, that person thinks they agreed to a situation that has then really changed. And we'll talk about this in a little bit, but that all contributes to the sense of shame that a lot of trafficking victims feel, because often they feel like they agreed to the original terms, and even though things have changed and things have gotten really bad, they still have that feeling of, I sort of got myself into this. So that's something to keep in mind when we talk about what it's like to be a survivor. Another thing that we see in terms of recruitment, is force, people being forcibly assaulted or taken to a job site. That's something we see less frequently here in Maine, but that does happen. And then we also absolutely see just manipulating someone's vulnerabilities. So, a trafficker using the fact that someone has a criminal history or someone is undocumented and that so they can't work legally as a way to control them and get them to perform labor. One way to think about trafficking is that the way someone is marginalized in society is the same way they will be made vulnerable to a trafficker. So traffickers will figure out what is hard about life for that person and really use that against them. And so then once someone's in a situation, there's a number of ways that someone can continue to be conditioned to remain in that situation. So we look at emotional abuse, threatening to tell friends and family that someone's involved, threatening to tell immigration authorities about what's happening. And then we also see physical abuse, isolation, denying someone their basic needs like food or shelter. And then some other means of coercion as well in terms of withholding or supplying needed medication, or for people, and I think everyone in this room is probably aware, the opiate epidemic is absolutely alive and well here in Maine, and that's using opiates as a tool of control is absolutely something we see. So often traffickers can, get someone to begin relying on opiates and then withhold them until they perform the labor they want. So that's absolutely a tool of coercion we're seeing. And then just, to just put a little bit more detail into it. So again, when we're talking about force, fraud, coercion, we want to be really clear about what that is. So force is, the most obvious. So that's physical force. So either actual or threats of physical or sexual assault, isolation, torture, really, really not good stuff. And I think what we often think about when we think about someone forced into a situation is that component of abuse. Fraud I've pretty much covered in terms of talking about the false contracts. We hear from people a lot who think that they got into a situation that was going to lead to something else, so that they might have started working with someone who presented themselves in one way, and then it turns out they were actually all along had a very different agenda. So that's sort of fraudulent control. And then coercion, as I mentioned, there's the withholding of substances, also withholding of documents, which we saw in the video. So in the case that I mentioned with one of the labor cases we're working with, part of how her trafficker was able to keep her in that situation is they immediately took her visa upon her arrival for safekeeping. They said they were going to put it in a safe to keep it safe for her, and actually that was really a tool of control because she was not able to move freely. And that's a real concern, obviously, especially in this current administration. If someone does not have access to their own documents, can't prove their own status, it puts them in a really, really vulnerable position, and they are often used in that way to continue to keep them in the labor situation. This is a handout we're not going to go over extensively. It's in your packet. It's really hard to see on the screen. But does this look familiar to anyone, the power and control wheel? Has anyone seen this in another setting before? If yes, awesome. If not, you probably will again. This is a sort of visual tool that's used in a lot of settings, especially with domestic violence and sexual assault. So basically what this does is it just kind of continues to articulate that when we talk about trafficking, there's not one way that a trafficker controls a victim, but there's this whole sort of spectrum of ways that someone's life is really controlled. And so, a couple of the categories there we've already covered, but talking about, a trafficker using their privilege, using their economic status, these are all different things. So this is all something that's helpful to keep in mind, that we don't want to have assumptions or stereotypes in our mind about who a trafficking victim is and who a trafficker may be. It really breaks down in a lot of different ways, depending on the person's vulnerabilities. And then just very briefly, we talked more about the federal law, but just to make sure that everyone is clear on the laws here in Maine. So we don't have a specific, blanket trafficking law on the books. There is a law that's a felony. It's aggravated sex trafficking, and this is pretty similar to the federal law, in that you need to prove that someone has, had elements of coercion to get them to engage in the commercial sex act for someone else's profit. We don't have anything similar for labor trafficking. There's this kidnapping and criminal restraint law, which can apply if someone's documents are held. And there's also a bill right now, Ridelphine just testified in Augusta last month on this bill. There's a forced labor bill that has been brought to the legislature, and that's still in process and kind of in the early stages. But these are the laws that we have on the books in Maine.
And in terms of data, here in Maine, there has been some research about human trafficking that states about 200 to 300 cases of sex trafficking in Maine, but no data on labor trafficking. But you can feel it's like we really have limited data around human trafficking, and we still need to work on like increasing partnership around this issue to try to find more and accurate data, and like increase identification as well as expand the laws around human trafficking. So no data, it titled data, but no numbers, sorry. And so in terms of what we have been seeing, our coalition works since 4 years now, and so we have had 155 clients, also people who have experienced human trafficking, and those are data that we have is for the beginning of this month. And as you can see, 80% of our clients are trafficked for commercial sex. Again, I mentioned that there is a higher awareness around human sex trafficking, and one of the reasons, the prostitution thing is one of the reasons why we think we're having more cases of sex trafficking versus labor trafficking, and it's really complicated, to identify victims of labor trafficking, and that's why we're trying to do as much outreach work as possible so people can be aware of that as well and can be able to identify, so we see if we can work on more cases of labor trafficking as well. We want to work on cases that really reflect the reality of things, how they are happening. And also something that we want to mention here, the IPEC, which is the coalition, works with anybody. We work with all sex, all genders, all children and adults. And also, so 60% of our clients are, over age of 25. And before, we were thinking that we could have more cases of children, but actually we have more adults. And one of the reasons is that some people get to us, by the time they get to us, maybe they started experiencing that trafficking before, when they were minor, but by the time they get to us, they are already adults. And another thing is that one of the big problems that all the victim of human trafficking have is housing. You understand that Kathleen mentioned that the traffickers, one of the things they do, they meet their victims' needs, they meet their real needs, but so when they exit that situation, you might imagine that they might have all the needs as well. So most of the victims have that need of housing. We're going to talk about the needs of our clients when they get to us, but also something that I wanted to highlight here is that 75% of our clients also have whether a mental health or a substance use disorder issue or both. And about our approach, so the coalition approach, PTAC approach, is client-centered. We meet our clients again where they are at. We want to make sure all our services are centered on the client's needs, and we work with them on their safety planning. We give them options. We want to make sure we don't tell them what to do, because that's might be one of the things that they've been seeing with the trafficking experience. We want to make sure we give them options and we let them be the boss of choosing what they need and what they want to do. And in terms of services, we do intensive case management. We provide assistance with basic needs. Again, we are federally funded. We have a small client assistance fund that we can use to help our clients. Usually when they come to us, again, they have a lot of needs, especially basic needs like foods, clothing, hygienic products. And also we do mental health. One of our partner coalition is Day One. Maybe we want to talk about it, but we have 5 partners in our coalition, and we all work. So Day One is a mental health provider who have been helping our clients to get mental health treatment. We work on shelter and housing. We can use, when they exit the trafficking situation, when we're planning on safety needs, we have shelter options that we work with them on. Like we have a bed. I don't know if you are all familiar to Florence House, which is one of the Preble Street programs. So we have a special bed in Florence House that we use for our clients. We also have now some DV shelters that are accepting human trafficking victims, and we use those as well. So we also do the linkage with other resources in the community, so we are able to provide like a little assistance and connect our clients to other resources in the community. We also do legal assistance. We work with ILAP, which is also a member of the coalition for any legal immigration. For example, the clients that Caitlin mentioned who don't have their passports, ID documentation. We can work with them on a special visa, which is a T visa that is available for victims of human trafficking, and we have been working with ILAB on applying for those visas for our clients who have that need. And also we work with other in legal, we work, for example, with Pantry Legal on some civil cases, like when we, some of our clients have been involved in criminal activities and they might have problem to access to housing, like when they do background check, they might not be able to access to housing because of their past criminal activities, and we work, and we've been really having a lot of success working with Pantry Legal for a client who have been denied for an apartment because of her, past criminal background, and then Pantry Legal help with lawyers who help the person to get their rights back.
So very briefly, we'll just back up a little bit just so that way, for those of you who aren't already familiar with Preble Street, we are a social services agency, and just one thing to keep in mind as you're entering the field and potentially working with people. We're about to talk about identification in just a minute, but what we have found is like using the philosophy that works at Preble Street is like really focusing on 3 things where we're giving people low barrier access to service, focusing on connecting them to housing, even if they're not in a place where they're managing their mental or physical health or their substance use, still helping them get into a shelter situation without having them to do other things first. And then harm reduction. So we work with people who are still often in really vulnerable situations, and just trying to be realistic about how we can safety plan with people has proven to be really helpful in terms of working with people who have survived this. Now we're going to look at just a little bit of information about what we're seeing trafficking victims as their needs. So thinking about this issue as a larger community, what are people in Maine who have experienced this really needing help with? And so these numbers come from our, when we screen someone in, we're asking them, what do you want to work on? What do you need help on through case management? And, as you may or may not be able to see from where you're sitting, but long-term housing is really the number one thing that people need help on. So they're looking for emergency housing as well, and then a whole range of other needs. So mental health is a huge need. Taking care of basic needs is another big need. Something that we don't see mentioned as frequently as housing or mental health is also physical health, but that's something that as we work with someone, almost always people have dental needs, people have chronic pain issues, people have all these things going on, with their bodies and minds that they haven't been able to address. And so that's why, when we think about going into healthcare spaces with clients who sometimes have been marginalized by authority figures, it can be really scary for people to kind of reclaim their bodies and take care of their health needs. So when we think about how someone is vulnerable to trafficking in the first place, we've been talking a lot. We're going to move into our panel in probably about 10 minutes, but let's just take another moment. If you can just kind of do the same thing you did and just turn to the people around you. From what we've sort of laid out so far, what are some of the things that you think would make someone vulnerable to this crime? Goodbye, pharmacy students. I know you guys have a class. Thanks for coming. So let's just take like 1 minute and just talk with the person next to you. What could make someone vulnerable to being trafficked? And then we'll come back together.
Oh my gosh, that's a lot. So we can, like, we can move on, I feel like we want to focus, How about we talk a little bit about indicators and we move to scenarios? And, I think, like, the indicators are also really important. Yeah, because, we say we want to identify maybe we can, this is not really a study as long as they are not like actively providers. And the structure will spend a lot of time. Okay, that's all right. Thank you. I got up and you were on.
Let's do indicators, scenarios, discussion about why someone might not report, and then should we just leave it at that?
Yeah, I think that's okay.
All right, so for those of you who are staying with us, let's come back together and let's talk about vulnerabilities. So from what we've talked about so far, who can share some things that they think or the people around them we're just talking about might think that would make someone vulnerable to being exploited in this way? We've got our roving mic. Thank you very much.
Homelessness is one, and then children in a vulnerable
Homelessness.
and children in a vulnerable situation at home, parents that are not good parents.
Yep, absolutely. Right, when someone is leaving their home, if they don't have anyone that they're connected to and they're just kind of out there on their own looking for some support, looking for some validation, absolutely. What else? What are some other vulnerabilities? I saw you had something over here. I'll come get you.
We were just saying anywhere that there's sort of a basic need that's not being met. So like you were saying, homelessness, so anything with housing, any medications. We also talked about if there's a history of any sort of emotional, physical, sexual abuse, it can become normalized, things like that.
Yeah. Really good points, absolutely. Other thoughts? You guys are great, you're hitting on everything.
If someone doesn't have a support system, so they don't have anyone to turn to and they're kind of isolated.
Yeah, and that can be with someone who's a young person or someone who's an adult. And thinking about, when they're not able to meet those basic needs, same thing where there's a gap, if they're not connected to a system of support, they really often feel like there's no way to meet those needs and move forward. Yeah. Anything else?
like engagement in some kind of illegal activity, so maybe there's some fear of authority already.
Yeah, absolutely. If someone's got a criminal background, that's a major barrier a lot of times to someone, getting other forms of employment, and so might be more vulnerable to getting scooped up by someone with some really good promises. Yeah, great. All right, so yeah, you guys pretty much hit on all of these. I mean, when we talk about youth, especially runaway and homeless youth, one thing you didn't mention, but that we've been talking about, definitely when folks are out of status and people are displaced, that can be an additional vulnerability. And then, really the main thing to highlight is just people who are otherwise oppressed or marginalized or living in poverty. That's a really broad sort of category that encompasses a lot of these things. So lack of access to basic needs, feeling like you are marginalized in your community and that you're isolated can really make you vulnerable.
We're going to talk a little bit about the indicators. So in the handout that you have the main screenings tool, and you're going to find all of these indicators if you have some time to read them. But we're going to just talk a little bit about those indicators and move on to our panel part of the training today. So some of the indicators that you can see for a like human trafficking victim is, we have mentioned it, no access to personal identification. We've seen a lot of those cases, or here and there, where if you're working with somebody and they don't have access to their identification documents, that might be a sign. And again, this is not. So you can see all of these signs or some of these signs for somebody, and it doesn't mean that's a victim of human trafficking, but it's just something when you see might make you think about a trafficking happening, and you might want to ask more questions to find out more about what's going on. So like somebody who is traveling across the states without any known resources, you want to, if you're working with a client, a patient, you might know that they don't have any resources, but they've been telling stories about where they've been across the states. So that's one of the red flags that you might see. Frequenting hotels without any resources again. And one of the other things that we have seen is that somebody who always come with a person who are with them, like it can be somebody who has language barriers, and they always have somebody who say they are the interpreter, and they might be the interpreter, or it might be a family or whatever, but that's a sign. It might also be a controlling person who want to make sure they are there and keep controlling their victims. So you're going to read through. We're going to have to move on to our panel part, which is also exciting. So if you have any questions, you have anything? Yeah, yes, so, sorry. Before we get to our panel, we have a little bit of scenarios. Again, as we said at the beginning, we want to make it, as much interactive as possible. We're gonna have 2 scenarios, and we're gonna give you some time to work on those scenarios, and then I hope we have enough time for our panel.
Yeah, so we're just gonna read out this one, and this will be just a chance for people to just sort of discuss this a little bit. The idea is that it is sort of open-ended. So this may be someone who's experienced trafficking, it may not. So this is someone who you might encounter, and we're just gonna talk about what are some of the indicators or red flags that might come up. So Rosie presents at an appointment with a primary care provider complaining of chronic pain and an untreated skin condition. She says she works as a nanny and is accompanied to the appointment by her employer, who is from the same home country as Rosie. Rosie's employer says that she will act as the interpreter during the appointment. So let's just maybe do the same thing we've done. We'll just take a couple minutes and just talk about this a little bit. What are some of the things from our, sort of quick crash course on trafficking that might stand out to you in this scenario that might be of concern? So let's just take a couple minutes, turn to the folks around you and talk, and then we'll come together. right, so let's come back together. And again, this is, we don't know what's going on with Rosie. This might be the first point of contact, but what are some of the things just from this brief scenario that might have stood out to some of you about, things that are possibly concerns, things that might be red flags? Yeah, all the way in the back there, would you mind? Who was it? Sorry.
We talked about the length or the kind of how long the pain was going on for and the skin condition, because if that was a good working relationship or normal situation, Rosie would have gotten care a lot sooner, so that could be a good way to kind of take a pulse on the situation.
Yeah, that's a great point. Why hasn't she been to a doctor beforehand, right? On one hand, like the employer might seem like this nice person who's coming to take their employee to get care, but yeah, why has it taken this long? Yeah. What else?
I think whenever you have a person who's in a position of power over someone else as the translator, that is a sticky situation. And I think it should be up to the healthcare facility to make sure that's not happening. Yeah.
They should provide their own translation. I'm pretty sure that's against the law.
Absolutely. So, and we've done these trainings to folks at like Grand Rounds for Maine Med, and we know that, when things are very fast-paced and intense and someone's right there who seems trusted, hospital staff should not be letting some like random third-party person who says, oh, I'm a safe person, I'll interpret. You have no idea what the person is saying. So yeah, always having a trained interpreter to make sure you know what's going on. And then whenever possible, right, like good practice to have that person, alone with the interpreter without anyone else there, even just for a moment to just check in and say like, are you okay? Are you safe with this person? We've heard from several of our clients, several different types of trafficking situations that we have like one person in particular who their whole exit plan was to say that they were on the verge of suicide, that they needed immediate mental help because they knew if they showed up at an ER, they would be alone and they would have a chance to say, I'm not safe with the person who brought me here. So, folks see healthcare settings as places where they can really be seen. So that's just important to keep in mind, like getting that person alone and finding out from them what's happening. What else? Any other things that stand out?
Just going along with like the employer being in control, I think it's kind of awkward to have your employer at a doctor's appointment with you. I've never had an employer at a doctor's appointment, and I just think that kind of speaks to another part of the control, that they're in there and they're in the know with everything going on.
Yeah, absolutely. Yeah, just the fact that the employer's there at all could be its own major red flag. Yeah. So some questions that you might ask Rosie, like if if the employer is if you're able to get the employer out of the room, some of the things that you'll see on the screening tool as indicators, if someone is really not oriented to where they are physically, if they don't know, that they're in downtown Portland at Maine Med, if they're really unfamiliar with like the geography of Maine. Ridelphine was mentioning earlier about like traffickers being neighbors. We've had a couple domestic servitude cases where, to the sort of neighborhood eye, everything seemed fine. They just didn't see the one person in the family a whole lot. And so that's just something to think about. If someone's really seeming like they're at an appointment for the first time in a very long time, just getting a moment to talk to that person about like, how are you? Where are you in space? Like, what's going on in your life? You don't need to be asking really explicit questions, saying, I think you might be a trafficking victim. Are you? Yes or no? But really just having that human connection about what's going on. Are you okay right now? All right.
Yeah, and they might not know that what they're experiencing is a trafficking situation, so they might be fine with that. All right, so a really quick thing to talk about before we leave is, you want to present this partnership with?
We can skip it. So we're going to bring up, we're going to move up onto the stage into some chairs, and we'll keep our mics. And what we'll do is we're just going to have some sort of questions to see if there are any, questions that you have. We can talk a little bit more of some of the as confidential as we can make them, anecdotes from some of the things that we've seen working with people. And I know we just threw a lot of information out at you, so feel free to ask clarifying questions, things that are confusing. And we're just going to have Alicia join us and talk a little bit about her work here at UNE. So if you have questions for her as well, you are welcome to do so.
Hello. So I'll keep my introduction short so we have plenty of time for questions. But really quickly, my name's Alicia Peters. I'm an anthropologist in the Department of Society, Culture, and Languages up on the Biddeford campus. And I'm really excited that IPEC was able to organize this event along with PSACT. I encounter a lot of WCHP students in their first 2 years in my medical anthropology classes, and so I'm really excited to learn about these events and resources through IPEC. I'm also thrilled to be joining Caitlin and Ridelphine. PSACT is such an incredible resource in our community, and they offer such really thoughtful and important services. And they're really the experts here today. So I've come to know Caitlin and Ridelphine through research that I've been doing on the human trafficking response here in Maine and northern New England. I started doing research on human trafficking about 15 years ago, shortly after the passage of the Trafficking Victims Protection Act. So as a doctoral student, I was investigating the kind of really complicated process of that initial implementation of the law. And you've been introduced to some of the kind of tricky and complex aspects of the definition and what it means to identify victims and survivors. So that was based primarily in New York City, and I did some work in Washington, D.C., and published a book based on that research. And then when I moved back to Maine and came to UNE, I started doing this current research project on the human trafficking response here in Maine and New Hampshire. And so I've been looking at three things basically as part of this project. One, just what's changed basically in the last 10 years or so in terms of what the response looks like as people have come to understand trafficking better. Also looking at what the response looks like as it shifts to more remote areas of the country, like Maine and New Hampshire, because the responses come here a little later than other places, like big urban centers or places with large agricultural sectors and migrant communities where some of the very early big cases emerged. So we're seeing that more now here. And then finally, the third piece of that is looking now that every state in the country has some form of human trafficking legislation, what that looks like as state and local laws start to intersect with the federal law and that response. So I've been doing, working with and interviewing service providers like Caitlin and Ridelphine and some of the other multidisciplinary teams working across the state. I've been doing interviews with law enforcement, both federal and local, and then really critically talking with survivors as well and trying to incorporate their voices and perspectives and experiences on how they're affected by the response and focusing not so much on their victimization, but also looking at their strength and resiliency and how they are impacted and try to incorporate their voices into a more academic work that can affect policy, which is always my ultimate goal. So I'll leave my introduction at that so we can move on to our conversation, but thank you for including me today.
Thank you, Alicia. So anybody has a question for Alicia or for us, you're welcome.
Hi, thank you all for being here today. I feel like this is a really important issue that often goes undiscovered, I think, by a lot of health professionals. I guess my question is about the interplay between the different systems and helping survivors and helping survivors kind of come out of their situation. And that means like in between law enforcement, the judicial system, and kind of maybe service providers, and how are people working together maybe in this state to make sure that they can better meet the needs of survivors?
So I think as Ridelphine mentioned earlier, our program has been around for about 4 years. And one thing that we've seen is when we first started, about 100% of our referrals were from law enforcement. So it was, always law enforcement sort of identifying people, connecting us with services. And there was a period of time where there were times where services for survivors, and this hasn't happened just in Maine, this is something we've seen kind of all around, were almost used as like a carrot. So like, cooperate with our investigation and we'll connect you with these, people who will help you with housing or whatever you need. And I think what we've seen is that there's been a lot of like really good multidisciplinary collaboration around, I think, law enforcement and social services kind of knowing what their roles are and trying to be really clear with people about that. And so, one of the ways that we operate is that we don't require anyone to have to report to law enforcement in order to receive services. And I would say fairly often, people who may not initially want to report, once they get a little bit more stable, then are like in a place where they think they might want to. And then, and we've been able to see our law enforcement partners sort of see that. So I think that's been a shift that we're seeing, that law enforcement, there are situations where there's an immediate safety concern or someone's in custody and they're, wanting to get a statement, and things can move really fast. But we really try to work, and I think our law enforcement partners, both our federal and our local, are increasingly recognizing we don't want to put trafficking victims in the same place where they feel pressured to provide information to law enforcement, just as they felt pressured to perform labor with their trafficker. And then just another thing I'll add is that there are some different sort of supports and resources available depending on if someone's part of a local case or a federal case. And so that's another thing that we can kind of explore. If we have people who are in a federal case, there's like a fund for emergency witness protection. If someone's trafficker is out in the community and they don't have a safe place to stay, we can access that and work with law enforcement partners to be able to put someone in a confidential location in a hotel, or help them get the medication they need if they don't have Maine care to pay for it. So there's some different ways that we can kind of collaborate in that way as well.
Any other question?
My question was, I guess in a clinical setting, if we suspect that one of our patients is a victim of human trafficking, aside from the referral, what would you say what are the best things for us to do? You know what I mean? Because I don't think any of us, or at least I wouldn't know what to do if this happened to me next week.
So I think, one thing you can always do is to give us a call at the coalition. So one of the things that we do is technical assistance as well as direct service with people. So if you have someone in front of you who, is not, so a couple different things. So if you have someone who's not disclosing that they're a trafficking survivor, if you're not getting the sense, you can have that open conversation with them, but your sort of spidey sense is tingling and you feel like something might be going on, you can call us. You don't have to give us the person's name, and we can sort of talk through and provide support about next steps and how to start that conversation with someone, how to do safety planning. But then if you have someone who, in a clinical setting, as they're sharing part of their health history, might say, and this is another thing that's been going on with me, and they just, let you know, and you can say, oh, this is a trafficking situation. What we usually tell providers, and kind of a follow-up to your question, one thing we've seen is that as we've done more outreach, we are getting more referrals from the community as well as from law enforcement, which is great, and we want to see that happen. So if someone's ready to be connected with services, you can give us a call, and we can, what we'll need to do is do an intake to screen someone, but we can do that in a setting that they already feel comfortable with. We've done intakes at Spring Harbor, Broadway Crossing, People's Doctor's Office, offices of therapists, Dunkin' Donuts. There's like all these different places where we can meet where people are comfortable. So if someone is, if you've got someone that day who's like, this happened to me, I have these needs, I'm ready to connect, we can try to move pretty quickly to be able to connect with them.
And also for after-hour services, you can use the National Human Trafficking Hotline with the 800 number. We're gonna put the number available. I think you can find them in one of the handouts on our one-pager. There is a number, hotline number that can help if there is really a need to contact somebody.
I would also just add, in terms of your question about the clinical setting in particular, there's a organization that was founded originally out of MGH in Boston, and it's called the HEAL Network, that you can join a listserv, and they have an incredible amount of resources on their website in terms of putting together protocols and tips for encountering potential trafficking survivors in the clinical setting, in terms of you encounter somebody, what do? You don't want to put them in additional harm, and how to actually deal with some of those situations. So I'd check that out as well.
I'll just add one last thing to that point, is that one thing we always want to really emphasize with people is to empower people to sort of in some ways do what you normally do when you're encountering someone that has a need, and that if you are in a situation where someone discloses to you, one of their greatest fears is that the person they're opening up to is going to freak out or not be able to handle it. So another just an immediate thing is just really hearing that person and knowing that you'll be able to go to your supervisor or go to a peer and sort of process what it was like to sort of take on their story in that moment, but just trying to stay really grounded and listen to that person and talk about their safety, asking them questions of, do you feel safe now? If not, no, and letting them know that you want to try to get some more resources to help them. You don't have to have all the answers in that moment, but it is good to just be able to stay calm and really stay open and really listen to what they're sharing with you.
Hi. Curious if you could speak to where this is occurring in Maine. I know you mentioned that we are in more of a rural state as far as New England goes, but I'm just curious if it's more in Portland or in more of the rural communities, and if geographic isolation is a factor to overcome with this.
So the hotline, the National Human Trafficking Hotline, is reporting calls from every county in Maine. So this is something from our law enforcement partners echo as well, that it's there's not any one place in Maine where this hasn't happened. Since our program is focused on southern Maine, Cumberland and York, that's where our greatest area of expertise is. But I can safely say there's a lot of mobility among the people that we've worked with. So often we might encounter someone in Portland whose trafficking happened in southern Maine, or a lot of times people are being moved across the state down to other areas in New England, but they might originally have been born and raised in a smaller, more rural community, and then have left home either as a young person who ran away, or someone who wasn't getting their needs met and came to Portland, or came to Lewiston. This is something that's happening in Lewiston a lot, in order to seek resources. So I think we're certainly folks are being identified more in the larger cities, but that there are conditions happening across the state where people are not able to meet their needs and are vulnerable to that sort of exploitation. And sometimes that recruitment's happening in those smaller communities, but I think often it's happening once people get to a bigger community.
And another thing that I would like to add is that so we want to be aware of something that can be there are a lot of things that can be the reason why victims might not report that they have been, the experience that they are going through. One of the things can be like, to be afraid of the law enforcement. They might be in trouble, they might have involved in other criminal activities that, like we said before. Also, fear of deportation. All those things might be, the reasons why people might not report the situation they are going through. And we think that there are a lot of cases that are out there and that are not reported just for those reasons. Any other questions? Yes.
Sorry. I wondered how PSATS is funded.
Our funding comes from TVPA, which was established to provide all the services, so that there's money for victims that's through the Department of Justice and then through the Office for Victims of Crime. So just a little bit on the origins of the coalition. So our program director, Daniela Cameron, she was working at the Preble Street Teen Center. It was about 5 or 6 years ago. And teen center staff, as well as community law enforcement, were starting to see more young people who were being exploited in this way. And around that time, the Greater Portland Coalition Against Sex Trafficking and Exploitation was formed. So that's a group of law enforcement providers, social service providers who started to come together to recognize that this was an issue. So then Preble Street ended up applying for this grant through OVC, and the program was funded starting in I think the funding actually came through in 2014. They started providing services in late 2013.
I know you mentioned that the current conversation on immigration provided sort of a barrier to victims accessing care, but do you find it as a barrier to provision of care to them as well?
So the T visa that Ridelphine mentioned is a specific visa. It's a specific legal immigration remedy for people who were trafficked into the United States from their home country. And part of the requirements for that application is that victim survivors are agreeing to cooperate with law enforcement as is reasonable. And so that requires making a report, and then once you make a report, you can have what's called continued presence, so that's a way for you to remain in this country. What we have seen is that there's just, and this is happening in Maine, but also across the country, a greater fear around making that report to law enforcement, because for someone who is currently undocumented or might have come over on a temporary work visa, which then once they get away from that exploitative employer, that work visa is not valid, so then they're out of status. And we as social service providers, we don't want to tell someone, oh yeah, you have to go make this statement to Homeland Security, but it's going to be fine. This is for your T visa. So we can't guarantee that. So I think that there is a greater fear around that. I think we actually just got some information through a message board. There's a couple reporters who are doing some national stories on this about how ICE raids, how all of these things coming from the DOJ down are affecting people's applications for T visa. So that's one major way that it impacts. But other than that, we don't report any of our clients' information to our funders. So we're not, we give everyone a confidential number, so we're able to keep their information safe. We don't require people to talk about their immigration status in order to receive services. So in terms of case management, basic needs, things like that, I don't think it's impacted as much, but we do wonder about referrals and people just identifying themselves as someone who's experienced this and putting themselves out there in that way, for sure.
And also we try to explore another way to get a T visa, which can be the trauma evaluation, which is, it's not really obvious to get a visa through that, but we want to explore that to get a therapist who makes a report for the person and shows the report that shows that the victim is not able to cooperate with law enforcement. And yeah, we've been trying. We haven't had any successful case with that, but we keep just trying.
I would also say, just since the beginning, I think this has been an ongoing issue in terms of undocumented survivors coming forward who aren't identified by law enforcement in the first place. And I think coming back to one of the issues that Ridelphine and Caitlin talked about in the training, that many survivors don't self-identify, they don't recognize themselves as victims, and so many of those survivors often seek out help specifically for immigration or through community organizations. This is what's been seen kind of around the country, and only discover that they meet the criteria for that trafficking visa once they're referred by another organization. And so definitely the current immigration climate is making even some of those providers more hesitant, I think, to refer their clients.
Hi. I'm wondering if you're seeing a connection between human trafficking and migrant labor. I'm thinking about people who come up to Maine for the blueberry harvest or for the fishing industry.
Yes, we really believe that there are a lot of going on, and so I remember we were doing a lot of planning around, like, going out, doing a lot of outreach, when there are those seasonal work coming up. Yeah, we really have that belief that a lot of people from different countries are brought here for those seasonal work and, be trafficked.
And one thing I'll say about that is that it's really because of the nature of that work. And so one of our folks that we have been in partnership and an ongoing conversation with is, they used to be Maine Migrant Health, now they're Maine Mobile Health. And so they do a lot of outreach for, healthcare for seasonal workers, and they do a lot of work up in northern Maine, and they're sort of like a known presence. And so that's part of it, is that, working with agencies who are already doing some of that work to sort of give them the tools and the assessment questions, so that way, we're not rolling up, having never been to the farm, being like, hey, can I talk to your workers about what's going on here? That really, it doesn't work. And so, from what we've heard, I think part of the challenge of identification in Maine, but with agricultural settings in general, is that when workers are moving based on the season, and so you might have people coming into Maine for blueberries and then going elsewhere for another crop, by the time they are identified, by the time trust and rapport are built for someone to feel safe to disclose, they may already have left out of the area. And then one other thing that we're seeing, we've gotten a couple calls through the hotline for the hospitality industry. So there are a lot of seasonal workers that come like further down the coast, like Kittery, Algonquin, that area. And there are situations which we haven't been able to tease out if it's trafficking or if it's a really exploitative labor situation, because the person who calls ends up saying, you know what, I have my documents, I'm going to leave, I don't want to upset like there are these like middlemen brokers, because like if I cause a problem or if I report this issue, they're not going to hire me back next year, and so I'd rather deal with this, sort of bad work situation, knowing that I will be able to come back to Maine next summer and make money again. So it's something that we, as Ridelphine said, we feel pretty strongly that there are situations of trafficking that may be happening in all of these different industries, but it's really hard to identify and connect and exit someone from that situation. And then another small wrinkle is that a lot of the response in Maine has been built on the amazing shoulders of the domestic violence and sexual assault agencies, who have hotlines, who have hospital protocols, who have shelter responses, but those really are primarily set up for victims of intimate partner violence. And so an unanswered question in Maine right now is what happens if we find a trafficking situation where there are 20 people of varying genders, none of whom speak English, on a farm up in Aroostook. Like what does the system's response look like? And that's something, to be totally transparent, that we are still figuring out in Maine.
I would also just add to that even though law enforcement isn't always the most positive way to encounter survivors, that there can be sort of negative aspects to that the way the current system is set up is that that is important way that survivors are identified, because law enforcement are looking, they're already policing prostitution and they're looking at sex trafficking, and there is not a similar system set up to identify labor trafficking. So it does become so important relying on these other partner organizations and having the training there in terms of identifying those populations too.
You have 10 minutes. Any other question?
I actually had a question. My experience has been more with minors that are from Maine being trafficked to New Hampshire and neighboring states. And, you know, I'm a social worker, so I never was too involved in the law aspects, but there was a lot of trouble trying to actually bring the traffickers to court on these charges. What are your experiences with minors in Maine, with sex trafficking specifically?
I mean, one of the ways that we operate is that we want to try to, we're trying to meet the person's needs and, wrap around some support for them. And one of the things that we've seen with victims who are under 18 is that there are so many services that are available for those folks. So what we've seen most recently, as Ridelphine mentioned in one of the demographics, a lot of the folks that we're working with are adults. The majority of the referrals we've gotten for young people lately have been preventative. So situations where people at schools, primarily it's been at schools, are identifying, youth who are, posting things on social media or, sort of engaging in behavior in the community with their friends that adults at the school are becoming aware of, that are raising concerns that someone, is engaging in behavior that seems like it could be, commercial sex trafficking. So there's been those situations that there's not a case happening. There's no, the youth is not disclosing trafficking. Law enforcement is not seeing trafficking. So what we've been doing with minors is a lot of these sort of like preventative conversations. And then there are child advocacy centers. There's one here in Portland. There's one down in York County. Those are places where if there is a youth who's involved in a sexually exploitative situation, they're interviewed by one trained forensic interviewer, and then law enforcement and social services providers will all be able to access that interview so that the kid doesn't need to be like re-traumatized over and over again. And that process has been a way that we've been using, like doing some of this sort of preventative work. So there haven't been any cases involving minors in the past couple of years that I'm aware of. Yeah.
One industry that interests me is fishing. Is there a market in Maine or in this area for those that are held against their will and forced labor, say on a fishing boat where you're gone for 30 days? What do you do with someone like that? He's really got to escape his industry to come tell you. Some others of these types of trafficking may, remain in their industry a little while, but you're still helping. The ultimate goal is to escape, but like fishing would be one where you're out in the ocean away from any resource or help, and you've got to pretty much escape your industry and never go back. Some of these others you can see are different, but I just was curious about it. I'd read about some international trafficking in victims that are on ships, Vietnam, things like that. How do you handle that?
I mean, as Kathleen mentioned, we are all getting, smarter and smarter about this issue because it's really complex and there are so many things that are going on. So one of the things that we are doing is to increase our outreach and to reach out to people where they are and to try to increase the partnership around the community, work with other organizations, like work with worker organizations. We have been in partnership with the Southern Maine Worker Center, who work directly with workers, and some other organization, Maine Mobile Health, all those people who closely work with the population. We want to make sure we reach out to them and work with them on outreach and just leave the word out there so people can be aware of things that are happening. As we mentioned before, we have been having a lot of referrals from community providers just because we have been doing this outreach and helping them to be able to identify those cases. So yeah, the thing I think we want to just have to increase our outreach and be a lot out there so people can know, can be aware, and can be able to identify and know what to do in case they find those cases.
And I think to your point about just the sort of isolation that's there, the industries where we're seeing most prevalent, or most the majority of the folks that we've worked with have come from, when we look at like commercial sexual exploitation as well as domestic servitude, those are settings that are in the community. So theoretically someone would be able to leave and access services, but what we're hearing from people is that the conditions of their forced labor were such that they were, even though they were, down the street from our office, perhaps, they felt completely unable to access those services. So, I think that's something that we see in terms of like looking at our capacity and where, what point we interact with people. There are some teams across, the country who include an investigator, someone whose job it is to be going out and to looking for these things. And where we're at, for the most part, our encounter with someone comes exactly as you've said, once they've done already the much hard thing of exiting that situation. And a lot of times it's like law enforcement who creates that, but more and more we're seeing hospitals being, someone comes in after, being beat up really bad and like left, and they're not, valuable to the trafficker anymore, and they make their way to the ER, and the ER calls us, and so it's like, okay, that's how the exit happened. But it's really, to your point of how do people who are in these isolated situations find out about supports and services? I mean, that's a really big, important question. Thank you all very much. My contact information is on the one-pager, so if you have any more questions, feel free to get in touch with us. And if you wouldn't mind just dropping off any completed evaluations up on the stage before you head out, we'd really appreciate it. Thank you.
Thank you so much.